Good afternoon, everybody. I am Joni Diamond, LCSW, a member of the National Association of Social Workers California Chapter DisAbilities Council, and it is my honor to have all of you here and my pleasure to welcome Ari Garnica Olvera, who is a healthcare advocate at the Center for Healthcare Rights in Los Angeles, California. Woohoo! He helps individuals transition to Medicare, ensuring informed coverage decisions. Yay! An advocate based on healthcare needs and financial situations. Quite the advocate. Ari specializes in navigating policy regulations, resolving coverage challenges, and improving healthcare access through advocacy and education. Oh my gosh. Ari previously worked as a program supervisor. This is amazing. At the Disability Rights Legal Center. Yay, go Ari, where he oversaw intake procedures and supervised interns. Wow. He holds a master's of public administration from Cal State University, Northridge. Yay, great school, and a Bachelor of Arts in business administration from California State University, San Bernardino. Another great school. Ari is dedicated to empowering diverse communities. Oh, do we need you? Through accessible healthcare education and advocacy. Ari, thanks for all you do and welcome, and we bless you for doing this.
Thank you. Yes. Okay, so today we're going to be talking about Medicare and Medi-Cal benefits. Thank you for that introduction. Um, and I think we have some information here about the National Association for Social Workers, the California chapter. If you want to, Jody, I think if you want to continue on and read off the mission statement for us.
Actually, I will go ahead and do.
Oh, okay.
Yeah, thank you so much, Ari. Hello, everyone. My name is Cindy Chen. I'm the PR officer for our council, and I like to just kind of welcome everybody and kind of read off our mission statement. Our mission is to provide an inclusive space for social workers of all abilities to network and collectively address disability-related concerns through education, resources, peer support, and advocacy efforts. The term disability is all inclusive, including those that are visible, invisible, physical, sensory, emotional, and or neurodiverse. We like to welcome everyone to join us. We do have monthly virtual council meetings. We have a QR code on the slide, and we will be sending this out later. And then, just to let everyone know, our next meeting is Thursday, April 24th from 7 p.m. to 8:30 p.m. PST. But everyone is welcome to join. And then we do have a contact email you can reach out, which is also on the slide. You can also join us on Facebook, and it is under NASW California Chapter Disabilities Council. All right, Ari, take it away.
Thank you. Okay, so once again, my name is Ari Garnica Olvera. I'm from Center for Healthcare Rights. I'm a healthcare advocate. The topic of today's presentation is going to be about Medicare and Medi-Cal and some of the updates for 2025. A little bit more about Center for Healthcare Rights. So Center for Healthcare Rights, we are a nonprofit organization that provides free education and assistance with regard to Medicare and other related health insurance here in LA County for folks, for residents of LA County. We are not a part of the Medicare program, nor do we endorse or recommend any particular insurance company or Medicare Advantage plan. Our services are primarily funded by the California Department of Aging, Health Insurance, and Counseling and Advocacy Program. I also want to mention that we have, in addition to our staff counselors, we do have volunteer counselors in the community at different senior centers and community centers that provide free in-person assistance. And for folks who may be joining us from outside of the county, the statewide number is listed. Quickly, I'll mention that there is an office like us in every county. And so that is the phone number. If you are, for example, in Orange County, San Diego County, there is an organization designated in each county to do similar work to that we are doing here in LA County. I also, before we jump in, I want to mention, I unfortunately can't see the chat because I'm sharing my screen, but we will be having a question and answer session at the end. So I invite you to put in questions as they come up. You know, they may be answered in other slides, but you can feel free to drop them in there, and then we will get to them at the end to see if there's anything else that we need to wrap up. Okay, so what are we going to be talking about today? So today we're going to be talking about Medi-Cal eligibility, benefits, and updates. Specifically for programs that are related to the work that we do, which is with assisting older adults and people with disabilities. How Medicare and Medi-Cal work together, Medicare and Medi-Cal coverage options for people who are dual eligible, meaning have both Medicare and Medi-Cal. And then I'll also be talking about the Medicare Savings Program, the eligibility updates, and benefits that provides. So now, with regard to Medicare and Medi-Cal, there is a difference in how you become eligible for these programs. So Medicare is the federal program that provides coverage to people based off of their age and disability status or disability status. In order to be eligible for Medicare, you must be a US citizen or have legal residence for at least 5 continuous years. The eligibility for Medi-Cal, on the other hand, is based off of income, only income now. We'll mention a little bit more about that later. And in particular, since I mentioned we're going to be talking about older adults, younger people with disabilities, I also do want to highlight that these groups do still need to meet these income limits. The cards, just so that we're on the same page, there are the Medicare card is the white card with the blue and the red line. And then the Medi-Cal card can either look like these two on the screen, which is a white card with blue letters, or a card with the California poppies. And that is the newer version, but they essentially serve the same purpose. Okay. So Medicare and Medi-Cal together. So there are benefits that Medicare and Medi-Cal work together to cover. These include hospital coverage, care, doctor services, prescription drugs, ambulance, labs, x-rays, emergency services, and mental health services. So these are things that both Medicare and Medi-Cal can cover, and when folks have them, they will work together to provide coverage in tandem. And for Medi-Cal, in addition, from when people have Medi-Cal, they do have access to some benefits that are specific to only Medi-Cal, such as dental coverage, eyeglasses, hearing aid, incontinence supplies, transportation to medical appointments, and then also long-term services and support. So this one's an important one for a lot of folks that I talk to. This includes things like in-home support services, adult daycare, CBAS, uh, and also nursing home care on a long-term basis. So these are things that only Medi-Cal can cover at this time. And so the programs that I'm going to be mentioning today are uh, related to folks who are, again, people who are older adults or people with disabilities. There are other Medi-Cal programs, but this is the ones that we're going to be talking about today. And this is the bulk of the work that we do is tied to these programs, or at least the demographics and population that we serve, that this is the programs that they're evaluated under. And so this includes SSI-linked Medi-Cal, the Aged and Disabled Program, Age Blind Disabled Federal Poverty Level Program, the ABDFPL, and then there's also Medi-Cal with a share of cost. It's called, the full name of it is Aged, Blind, and Disabled Medically Needy. And then also the 250% Working Disabled Program. And as I mentioned, the eligibility for Medi-Cal is based off of income. So there, as of last year, as of 2024, there is no longer an asset limit. So, savings and other assets that people may have do not count against them anymore for the purpose of their eligibility for Medi-Cal. Under the Aged and Disabled Program limit, now the monthly income limits are for a single person, 1,801 as of this month. So this is the newest, most updated information that just changed this month. And then for a married couple, it's 2,433. And so these are the numbers for California, right? So California is, Medi-Cal is California's Medicaid program. And so we do have different rules that from other Medicaid programs in other states. I'll also mention that these income guidelines change every year, hopefully. And so they just changed this year, the increase this year in this month and at the beginning of April. And so these are the newest numbers that we have. On the right-hand side is listed the two agencies, the Department of Public Social Services in LA County, and then also the Department of or California Department of Health Care Services. So these are the agencies that manage Medi-Cal at a state level and also DPSS at the county level. Okay, so now moving on to another one of those programs. So another one is Medi-Cal with a share of costs or shared monthly costs. So this is something that happens if a person's income is too high for the Aged and Disabled Federal Poverty Level Program. So a person may be approved with a share of costs. Yeah. And what that would mean is essentially that Medi-Cal or the share of costs works like an insurance deductible. Basically means that the Medi-Cal benefits are not active until a person pays for a certain amount for that particular month. So the share of costs is a monthly amount that you must pay for healthcare costs before Medi-Cal starts to pay anything. I'll mention that people who have a share of costs, they sometimes struggle to pay for their medical co-payments or for in-home support services. And so options that currently exist to eliminate that share of cost are by meeting that share of costs by paying those healthcare costs that I mentioned. So that could be like medical bills, um, other medical supplies that they can apply towards their share of cost amount for that month. Or there is an option of purchasing additional insurance, so additional health insurance in the amount that they are over the Medi-Cal income limit. So for example, if they're over by $250, they can purchase at least $250 to bring down their countable income for the purpose of qualifying for Medi-Cal with no share of costs in order to access the full Medi-Cal benefits. Okay. So another program is the 250% Working Disabled program. So this is another way that people who qualify can remove or avoid their share of costs. This is for people who have disability related income and who are over the Medi-Cal limit. So specifically, this is for people who are receiving a disability related benefit. So the eligibility guidelines for this include they must meet the federal definition disabled, must do some type of work for pay each month, and must meet the income limits. And so what that looks like is for earned income, meaning the income that they get from the work that they do, there is an income cap of, for a single person, 3,263. And for a married couple, they can have an earned income of up to 4,403. And then I want to highlight that this does not include disability-based income. Disability-based income under this program does not count towards the income limits. And this includes SSDI, workers' comp, and California State Disability Insurance. There are a couple of other disability-based income benefits that may qualify for this program, but again, the guideline is that they must meet the federal definition of disabled. So now that we've gone over those programs, how a person can become eligible, how do Medicare and Medi-Cal work together? So when people have both Medicare and Medi-Cal, Medicare pays first, so it's the primary payer, and then Medi-Cal kicks in and pays the remaining costs for medical services. Beneficiaries can see any Medicare doctor who accepts them. The Medicare doctor does not necessarily need to contract with a Medi-Cal plan or request authorization to see them. Okay, so as long as a doctor accepts Medicare, they should be able to see this patient. So how does Medi-Cal close the gaps in Medicare coverage? Well, Medi-Cal helps us paying co-pays and deductibles for medical services. It also helps with the monthly cost of Part B, which this year is $185. So that's the monthly premium for Part B, which is the medical insurance portion of Medicare. And then in addition, it can provide some additional benefits that are not covered by Medicare. And those were the ones that I mentioned earlier, which included hearing aids and incontinence supplies, and also in-home support services. So I'll also mention that when people have Medi-Cal, they will still be assigned to a Medi-Cal plan for the purposes. Usually this really only affects it, or it's for the purpose of billing, so managing billing as secondary. This plan is not necessarily going to be managing their network, since Medi-Cal is only secondary. So this is really for the purpose of organizing billing, and also to help clients access those additional services that are not covered by Medicare, such as transportation services, or getting help with when they have issues with billing, for example. I'll provide an example of last week. I had two clients who who are dual eligibles, and they received a bill for services, for a variety of different services that they had gotten. They had been approved by Medicare, but for some reason the doctor's office was sending the patient a bill. And so those situations, what I was able to help them with was referring them to their respective or excuse me, their Medi-Cal plan, and the member advocates were able to help resolve that billing dispute. And so that is the purpose of having, or that is one of the reasons that it can benefit them having being assigned to a Medi-Cal plan. And the vast majority of people who have Medi-Cal are assigned to a Medi-Cal plan. But again, I want to highlight that for people who have Medicare, this plan is just secondary. There also exists a type of plans called dual eligible special needs plans, or DSMP, also known as Medi-Medi plans, which are a type of Medicare Advantage plans. So these plans provide all of the benefits of Medicare and Medi-Cal services under one network. Members who join these types of plans will be in a matching Medi-Cal plan. So these types of plans include the ones listed here. So there's many different companies that are offering these types of plans. And these are optional. You know, no, people don't need to enroll in these plans, but the benefit of these plans is sometimes they may offer some additional services, and or they may help with additional coordination of medical services, or have, for example, some of the plans may have um, uh, member advocate that works with them to coordinate their care. So that's some of the benefits that the person can receive through being in a DSMP plan. But again, it's not something that is required. Now, one of the important benefits that people receive when they have Medi-Cal is extra help. Extra help in the form of the low-income subsidy. This has to do with their prescription drug costs. So for people who have both Medicare and Medi-Cal, they automatically qualify for this financial assistance program. And what that does is that helps them with qualifying to enroll into a Part D drug plan. So a Part D drug plan that has a $0 monthly premium. In addition to that, their co-pays for medications are limited to the low level, which is currently $1.60 or less for generic drugs, and $4.80 or less for brand name drugs. The two plans that are participating that have a $0 monthly premium this year are WellCare Classic, so that's one of the plans, and the other one is Cigna Healthcare Assurance. So for people who are dual eligibles that are not in these two drug plans, they may be paying a monthly premium, And so sometimes it may be appropriate for them to switch to see if they can switch into one of these plans so that they can save that monthly premium. Okay, another benefit that you get through extra help is, and this year this actually changed a little bit, but you get access to a special enrollment period. So this allows you to change your Part D drug plan if needed. With beginning this year, there is some additional restrictions. So this year, they will allow you to change your plan every month, but you can only go from a Medicare Advantage plan to original Medicare, or you can go from a Part D drug plan to a different Part D drug plan, or if if either original Medicare or Medicare Advantage plan, you can switch into one of those DSMP plans that I just talked about. This year, as of this year, you can no longer go from one Medicare Advantage plan to another, nor can you go from original Medicare to a Medicare Advantage plan. You will only be able to make this enrollment if you have a different special enrollment period. Other than that, you can only do it during the open enrollment. So another financial assistance program is called the Medicare Savings Program. So the Medicare Savings Program helps with the cost of monthly premiums for Part B. And sometimes, depending on the eligibility level and somebody's income and need also, if they need assistance with Part A, it can help them with Part A. That would be in the case of, for example, somebody who does not have the work credits to qualify for free Part A, meaning they may not have worked in the United States, or maybe they migrated to this country at a later age, and they never worked in this country, so they don't qualify for free Part A. The Medicare Savings Program, through one of the eligibility limits, can help them with qualifying for that. And another assistance program that I actually mentioned in relation to Medi-Cal already is the Extra Help Program. But for people who don't have Medi-Cal, or who for some reason only are interested in getting assistance with their prescription drugs, they can apply for that program directly through the Social Security office. And this would help them with reducing the cost of their prescription drugs. So for the Medicare Savings Program, in order to be eligible, you have to have both Part A and B, and you also have to meet the income limits. You apply for it through the Department of Public Social Services. That is something that our office can help beneficiaries look into whether they're eligible, and also provide assistance with the application for. So for beneficiaries that you encounter, you can certainly refer them to our office as a start. And here is a chart listing the different eligibility limits. So on the left-hand side, these are different eligibility levels of the same program. They're named differently because they may provide some additional benefits depending on the level of somebody qualifies for. So the one that would help people with both Part A and B is the first one, QMB. So that one has the lowest income threshold. So for folks who are below that income level and do not qualify for free Part A, that is a way that they can get assistance with paying for their Part A and B premiums. I'll also mention that as of this year, the asset limits have also been eliminated, or actually as of last year. And so B income is the only eligibility factor being looked at this year. And also these income limits that are listed, they already include a $20 standard deduction. The income limits for QMB are 1,325 for a single person, 1,783 for a married couple. Under the second level of eligibility, the income limit is 1,585 for a single person, 2,335 for a married couple. And then the third level of eligibility is 1,781 for a single person and 2,400 for a married couple. Okay, so all of these levels of eligibility assist people with the cost of Part B. QMB is the only one that helps with paying for the cost of Part A for those who are not entitled to Part A. QMB beneficiaries are protected against balance billing nationwide. So what that means is that the providers would bill them or would bill Medicare, and then they are the beneficiary is protected from not being charged the rest, so the balance that is remaining. So they don't have to charge the balance. And then people who enroll into the Medicare Savings Program as well are also automatically enrolled into that extra help program that I previously talked about. So something that is new as of this year is that there is automatic enrollment into Part A for people who don't have the work credits to qualify for free Part A if they are receiving SSI and if they already have Part B. For people who do not receive SSI and do not yet have Part A, they can apply for QMB anytime in the year. And if they're approved for QMB, the state will enroll them into that conditional Part A automatically. That's something else that our office can assist beneficiaries with looking into, whether they may qualify for that benefit. So that is something that you can refer to our office for somebody who might have questions about that. So back to the extra help program. So the Part D extra help program. So this has to do with the cost of prescription drugs. The way to apply for that program is through the Social Security office. You can apply on the website as well, Social Security website. So I also want to highlight that with regard to the benefits that this program provides, if you apply for it this way, they are different than the benefits that Medi-Cal provides, and this has to do with, or specifically, that's the copay level for the drugs. And I'll mention that a little bit later on what the limits are. They're actually on the next slide. So, but for the eligibility limit to qualify for this extra help program, there is currently a monthly income limit of $1,976, an asset limit of 17,600 for a single person. And for a married couple, the monthly income limit is 2,664. And there is an asset limit of 35,130. So I want to highlight that this is a little bit higher than what the Medi-Cal program limits are. So even if somebody is a little bit over the Medi-Cal limit, they can still qualify for some assistance with their costs of Part D drugs. This program has limits copays to $4.90 or less for generics, and $12.15 or less for generics, for branding, excuse me. In the asset limit, there is a $1,500 burial expense already included. And then I'll also mention that the home that somebody lives in, the cars, and life insurance are not counted towards the asset limits. Okay, so I want to highlight some of the questions that I receive or that our organization receives on a regular basis. So see, these are some pretty common questions that dual eligibles have for us. So the first one is, I have been on Medi-Cal for a while and Medicare just started this month. I noticed that Medicare deducted $185 from my Social Security benefits. Do I really have to pay for this? And the answer to that is no. So Medi-Cal will automatically start paying for your Part B premiums. You should receive reimbursement in a couple of months. If you are seeing that, if you keep seeing that these premiums are deducted for more than 3 months, you should definitely give us a call so that we can submit an inquiry with Medi-Cal. Sometimes there may be an issue with information on your account not being linked together, or there may be a mismatch on the names or the numbers, the social security numbers. So there can be glitches that can cause that problem for it to not be picked up. But again, if you do qualify for full Medi-Cal with no share of costs, then the Part B premium should be paid for by the state and they should not be deducting it from you. Okay, so that's one. The next question is, my doctor's office is charging me the 20% Medicare co-payment for an office visit. Do I have to pay the doctor? And again, this is for somebody who is eligible for both Medicare and Medi-Cal. And so the answer to that is no. It is illegal for the doctor to balance bill you for the Medicare payment. That means balance bill means that they charge Medicare their reimbursement rate and then they try to charge the remaining balance to the patient. For somebody who is a dual eligible, this practice is illegal. So you do not have to pay that. Sometimes, more often than not, this is an issue that happens because of a mistake. I'd like to I'll say that. Sometimes the office may not be aware that the person has Medi-Cal. They may have forgotten to bill Medi-Cal. Um, the patient may have forgotten to provide the information to the office. So a lot of times, there's issues that happen like that are as simple as just calling the doctor's office and having them rebill if they receive a bill. But sometimes, obviously, there is doctors that are trying to do fraudulent billing. So, these are things that you can contact us about, or your clients or their patients may be able to contact us about and ask us, so that we can look at it and advise about what options they may have to resolving that. 90%, I would say 90% of the cases that I see, it's just a matter of contacting the doctor's office and they are able to resolve it. But again, sometimes it's also helpful to contact the Medi-Cal plan to help with getting a resolution on a billing dispute. Okay, so moving on to the next question. I think this one's the last question. My doctor says that he cannot see me because he does not contract with my Medi-Cal health plan. Is this true? So the answer to that is no. Your Medicare provider does not need authorization from Medi-Cal health plan to see you. So they are able, even though they may say they're not contracted with a particular plan. Again, your Medicare is the primary, and for Medi-Cal, they're just billing them as secondary. So they don't need to be um, in their network, nor do they need to get authorization. They're just billing them as secondary. So they should be able to do that. They should be able to bill and see you. I'll also quickly note that on the doctor's side of it, they do, if they don't want to deal with that, or if they, for some reason, sometimes doctors are not don't feel that they're going to get enough of a reimbursement rate for it to be worth their time. This is the case for specialists sometimes. They do have the right to refuse services, but something that they cannot do is balance bill, as I talked about in the other question. So, again, they should not be billing somebody who is dual eligible for the balance. And so that brings me to the end of the presentation. We are going to be holding on for I'm going to be taking some questions. But I do want to highlight the contact information. So if you or clients have or somebody that you're assisting with, a family member, has questions relating to Medicare, right, or services or extend to other areas, not just what we talked about today, but it all has to do with Medicare. If they have questions about that, you can always refer them to our office. Again, our organization's name is Center for Healthcare Right. This is the phone number that you can reach us at. And we also do have a lot of informational materials that we put together on our website. So I would encourage you to look at our fact sheets. We try to make those fact sheets less condensed and like the most relevant information. So they're quite accessible. And I think, Cindy, were you gonna help me with the questions?
Sure, I can definitely do that. And we like to encourage everyone, if you have any questions right now, you can go ahead and type it in. And if that's kind of difficult for you, feel free to raise hand, and then we can also, call on you, and then maybe you can just ask Ari, whichever you feel comfortable with. I like to kind of ask, I'm actually really curious about the work program. I think, many of us are probably curious about that too. I am disabled, and I am working part-time. And the reason I'm working, only 16 hours for, a week, and also I actually have to ask the company to cut my my hourly pay, just so I can stay on Medi-Cal to get, my my medical treatments covered. So in that
Mhm.
situation, what would you suggest that I do? And I'm not on Medicare, so what is something that someone from your office would be able to suggest for someone like me to do?
Yeah, so under the 250% working disabled program, the monthly income income for a single person, it's 3,263 for earned income, and for a married couple, it's $4,403. So the application to the program itself is quite simple. A lot of the clients that I work with are they're not necessarily doing necessarily a part-time job or something official. A lot of the time the work that they're doing is something like a chore or a task that they're helping a friend or a family member with. So yeah, definitely. I mean, your part-time or full-time job that can help you with that can definitely qualify. But also, I want to mention that there is other ways that folks can qualify for it. So that I'll give some examples of my clients sometimes are like foot sitting or taking down phone messages or receiving packages at their house or helping a friend or a family member with organizing materials like art supplies or things like that. So the work requirement is quite minimal, right? They don't necessarily, there's not a requirement of, oh, you have to earn this much. There's no minimum. There is a cap, right? And For the earned income. But the disability-based income, if somebody's on SSDI, right? So the other feature is you do have to be or receiving a disability-based income to qualify for this program, or have received one in the past, right? So that includes SSDI, workers' comp, or California State Disability Insurance. So that's the other feature. But applying for the program itself is very simple. Typically, it's just 3 documents that they're looking at. It's the some usually for the clients that I help with. It's a copy of their Medicare card because that shows that they're have disability status, since if they're under 65. If not, another letter that shows that they're receiving a disability-based benefit. The other thing is a work letter. So if they don't have a part-time or official job, they can qualify based off of just a letter from a person saying, this person does this task for me. I pay them this amount of money. Here's my name and number. That's the extent of what that letter is. If they do have an official job, they can submit um, pay stubs. That I think that would qualify them, and then yeah, so it's just basically those items, the Medicare card, oh, and the social award letter or whatever their source of income is, right? So their disability-based income is what I'm referring to. So disability-based income letter, um, work letter or pay stubs, and then the copy of the Medicare card is usually what we submit for to help clients qualify for that program.
Thank you. Thank you. Okay, and then we do have another question from Matt. What are the pros and cons of Medicare Advantage versus straight Medicare, and is it easy to return to straight Medicare?
There can be, I mean, it's going to be dependent on uh, somebody's health situation a lot of times, whether it makes sense for them to enroll into a Medicare Advantage plan. Because what you're doing when you enroll into an Advantage plan is you're saying, I'm assigning all parts of my Medicare to this particular insurance company. And so I agree to stay within the network of contracted doctors and hospitals of this company. And I also agree to stay within the rules for getting services, right? So that sometimes means, for example, yesterday I had a client who is in a Medicare Advantage plan, and her doctor has been recommending that she get an MRI or prescribing an MRI for several months, I think years actually for her. And it had been continuously denied by the Advantage plan that she's in. And so, the reasoning that the Advantage plan is making is because of it doesn't fulfill or it doesn't comply with their procedures or their operating procedures or standard medical um, procedures, right? Like where they have to go through different levels of or other services in order to get to that. So she's having again that problem because she's in that Medicare Advantage plan. If she were on original Medicare, she would have been able to just go and get that MRI. She wouldn't need to get that referral nor approval to get the MRI. She could have just gone directly. So that can be one of the advantages of being on original Medicare is that you're not waiting for approvals, and you have a little bit more flexibility with regard to getting your services. The second part of it is, well, and then also, with Medicare Advantage plans, some of the benefits that sometimes clients mention to me is, well, I want to go on an Advantage plan because they provide a gym membership. So some plans may provide some perks that Medicare on its own does not cover, such as like a gym membership. Not all of these plans include, not all of the plans will include these things, but some of them may include like a gym membership, some more dental benefits, or a more robust vision coverage, or benefit for glasses. So those are things that you can get through having a Medicare Advantage plan. But then I also point out to folks, well, and I say, well, you have to think about it. Is this worthwhile? Right? You're gonna be more restricted. So is this gonna be worth it for you? So those are all the factors that you have to think about before making that decision. And then with regard to, well, can you go from a Medicare Advantage plan to original Medicare? So um, the answer is to that is, I mean, yes, you can do that easily every year during the open enrollment period. You can switch to whatever you want during that time. That's at the end of the year, between October 15th through December 7th. Throughout the year, you can only switch if you qualify for a special enrollment period, right? And so that was for folks who have Medi-Cal. There is some restrictions of when you can make a change, and what changes you can make. But for somebody who is a dual eligible, yes, you are able to switch from a Medicare Advantage plan to original Medicare.
Great, thank you. And then we have Joni with her hand up first, and then I do see Jessica's question after. So Joni, go ahead.
Thank you, Cindy, and thank you, Ari. I've got a client who is, I think Cindy may have addressed it or asked the question, and you addressed the response. The client is on Social Security, which is insufficient for her overhead, and therefore doing an annuity. What would this individual qualify for? Because it's over the single amount.
I think I would need to look at it a little bit more closely in regards to like what the actual amounts are. So I mean, I think that's something that you could refer to our office, and we could look at it a little bit more extensively, so that we can see exactly what the income amounts are, and see what programs may be appropriate, and if they're eligible for any of them. So I don't know if I'll be able to answer that question at this moment.
That makes sense. So thank you so much. I'll refer the person to you.
Yeah, definitely. Thank you.
Thank you, Joni. And then let's go to Jessica's question. She mentioned that you might have mentioned this earlier, but does Medicare help pay for dental or vision?
So yes, Medi-Cal does have a dental and vision benefit. So for dental services, thankfully, the dental services are a little bit more robust than they were in the past, right? So I believe as of this year, there is an $1,800 dental allowance that they provide, and this includes things like services such as fillings, cleanings, x-rays. So, but in addition, it does all Medi-Cal Dental does also can also cover more extensive services like root canals, dentures, partial dentures, which were not covered in the past. Obviously those services can be very expensive and they may exceed that $1,800 cap. But from what we know is that there is a way there is an option to request coverage if a beneficiary needs those services that the doctor can put in for treatment authorization request, and there is a possibility for those services to be covered if it is approved. Medicare on its own does not cover dental services at all. So dental services are on original Medicare are not covered at all. Some Medicare Advantage plans may have some additional dental benefits that are not uh, related to Medi-Cal, right? So when people have both Medicare and Medi-Cal, and let's say that they're in an Advantage plan that has dental benefits, you can't use them together. You can't combine them. They are separate benefits. So that's something that a lot of folks get confused on is, well, can I use this one and then have Medi-Cal kick in and pay, the remaining balance for it? No, they won't work together. They don't coordinate. For the vision benefit, um, I know that the vision benefit for Medi-Cal, it covers the basics, which is I think a vision exam once per year, and I think it covers frames every 24 months. So that's what the Medi-Cal vision benefit. Again, with Medicare, there is not that. They don't have routine vision coverage. Some Medicare Advantage plans may cover some vision benefits like that, but that's going to depend on the plan. Not all Medicare Advantage plans may cover that or offer vision coverage.
And then to kind of just add to that, I believe Jessica also asked, if you don't qualify for Medi-Cal, is there anything you can do to supplement these services?
If you don't qualify for Medi-Cal, so that would be in the situation. So the most common situation would be, if they don't qualify for Medi-Cal, that's usually because their income exceeds the limit. And so, yeah, I mean, the options that you have to supplement is for people who have Medicare only. One thing that we recommend is joining a Medicare Advantage plan. That's certainly one way to limit your out-of-pocket costs, because with a Medicare Advantage plan, typically you're only going to be paying the Part B premium, which is $185 per month. And then under that plan, instead of having a 20% co-insurance, you'll just have to pay the co-pays that are pre-designated by that plan, which are a lot lower. It could be just like $5 for a doctor's office visit, $10 for a lab. And actually, many of the Medicare Advantage plans are actually moving to having $0 copays for most of their services. So that is certainly one way that they can supplement their Medicare or reduce their out-of-pocket costs. Another option for those who can afford it is purchasing a Medicare insurance supplement, also known as a Medigap. So that is a additional private policy that somebody can purchase to offset those costs that original Medicare doesn't fully cover. So what I'm referring to is original Medicare covers 80% and the remaining 20% is the patient's responsibility. If they have a Medigap, right, if they're able to purchase a Medigap, then that Medigap can help with offsetting that 20% by paying it or paying a portion of it, depending on the level of Medigap that they purchase. So those are two of the ways that for people who don't qualify for Medi-Cal, the ways that they can supplement their Medicare benefits.
Thank you. And then Joni?
Yes, thank you both. I'll use myself as an example. I am 200 years old. I look great for my age. I am on Medicare because I'm a frequent medical user. I have a secondary, Blue Shield of California. I called your office in Medicare to see what are my options for a secondary. And Medicare does cover an ophthalmologist because they are a doctor, so I
Mhm.
pay nothing for my eye doctor appointments, who can also prescribe new glasses for me, and went to a place that accepts eyeglasses with Medicare.
Yeah, so that is a loophole that you could use. But one thing I'll point out is, as you mentioned, it's an ophthalmologist. So ophthalmologists are not just there for routine vision coverage. They're going to be, these services are going to be related to a medical service, which it usually would be for checking for glaucoma, or monitoring cataracts, or just looking at overall eye health for people, for example, who have high blood pressure or diabetes. These types of checks with an ophthalmologist are important and are considered medically necessary. And so, with along with that, it's pretty easy for an ophthalmologist to provide you with those other services. A lot of times, well, it's not really going to take them. They have to do sometimes those services anyways to determine your eye health or look at your eye health. So yeah, I mean, that is kind of one of the loopholes. Loopholes. However, what I want to highlight is, if you're just getting a routine eye exam, that is something that Medicare is not going to cover. So that is a little bit different.
Thank you, Ari, for bringing that up. You're absolutely right. I had two cataracts removed, nicknamed the Minion Twins.
Mhm.
So, yes, I did see the ophthalmologist for medical reasons, and he does follow up, which is covered by Medicare. So, thank you for
Mhm.
the specification.
Helene, do you have anything to add? I know we are a little ahead of schedule.
I do not. This was a great presentation. Thank you so much, Ari.
Yeah, of
We can
course.
leave,
I'm happy to share. Yeah.
we can wait a couple minutes in case other questions come in. We do have the until 1:30, so we have a little longer just to see.
Yeah, and also, sorry, I did notice, from the slide, I don't think we kind of talked about this, but and I know this is more, Medicare, Medi-Cal, but you did also mention high cap, and I do work for an adult D center, so I am a little more familiar with that program. If you have a chance, can you tell us a little more what that program is or what that looks like?
Well, that is our program. I mean, that is exactly what we do. All of everything that we're doing right now, even right now, like this is a part of HiCap, is community information sessions, outreach to community members, like at adult daycare centers, is we do, not just for professionals, but we also do, for the general public. We provide information sessions. And the other part of it is, and the bulk of our work is the casework that we do, right? So, my days usually look like assisting, Monday, Wednesday, Fridays, I have 8 appointments per day. And so, and then the other days I do presentations and I follow up and with the Department of Public Social Services, different health plans, pharmacies, to assist our beneficiaries. So yeah, HiCap is kind of the umbrella organization that provides the funding for us to be able to do all of this work. And so ICAP is funded through the California Department of Aging. So that's state funding, right? And then the other part of our funding is through SHIP, which is the State Health Insurance Assistance Program. And that is funded through Medicare under the Department of Health and Human Services. And so, yeah, um, right now it's a very volatile landscape, as we may all be aware of. And so certainly that funding is going to be in peril, I anticipate, right? But, thankfully, at least in California, we still have the support, and we will continue to hopefully have the support of um, ICAP, which, essentially these are two different funding sources that allow us to do all of this work so that people can still understand their options here. And for LA County residents, we are, I don't know, a lot of times I think we forget that LA County is the largest, by population, the largest county in the country. So it is a massive population, and um, that means that a lot of people, a lot of Medicare beneficiaries sometimes don't know like what things are gonna affect them, or a lot of the information as well is, right now we're being bombarded with things happening day after day after day, and it's hard to filter out what is important, what is actually going to be coming into play, what is actually being implemented in terms of these policies. And so, the other part of the work that we do is looking at what policy decisions are coming out, and what is actually being implemented, and informing the public about these things and how it's going to affect them, so that we can all help each other make informed decisions, right? So that we're not just funneling people into some of these pharmaceutical companies, right? Like, yes, certainly so it can be helpful to people, but it's also a lot of times, unfortunately, it can be detrimental to people as well. For example, one thing that sometimes changes from year to year is the plans that participate in that extra help program. So previously, there was like 6 different plans that were participating in that program, and over time, as those have dropped off, clients have remained on those other plans, and now there's a situation sometimes that I encounter every year where it's like the beneficiary is charging like 25 being charged 25 $50 per year, when they could be paying excuse me, per month, when they could be paying zero since they qualify for extra help. And so, these are some of the things that we assist with, is getting them onto that $0 monthly premium. And 25 $50, that is a lot, especially for somebody who is getting, maybe only a benefit of like $500 to us, or like, $1,100, right? Like, so that I would say that it is impactful work, and hopefully we can remain being funded so that we can provide this help to folks, because the other obstacles are with regard to disabilities, right? So sometimes um, I have clients who are visually impaired, or like who have hard of hearing, or and they present additional challenges in accessing and communicating with government agencies, with even your health provider. And so, that's some of the other work that we do. And then on top of that is the language aspect, because, well, even for somebody who is a monolingual English speaker, all of this is super complicated, and, the language is very unfamiliar. But, when English is not your primary language, or you don't speak English at all, and then on top of that, you may be, migrating from a different country where the health system is completely different. All of this is completely new and confusing, right? And so, that demystifying is also a large part of what I do, and what our organization aims to assist with.
Thank you. And yeah, I can't agree more. I think, and honestly, just calling into Medi-Cal, for example, takes hours of wait, and it's ridiculously like long, and every single person that helps have a different answer most of the time. So, I can't imagine how people with a language barrier, or,
Right,
struggling to understand the language, can actually fathom what is going on, what has been covered, and then they're hit with massive amount of applications they have to complete. And
right.
that's why I'm so glad that you're here, and your team, everyone out there is being assisted, that can reach out to your center. And then of course we have Joni. Thank you for also participating and asking lots of questions.
Thank you, Cindy. You're excellent at bringing out so many wonderful points.
Thank you.
And I want to share that it's also with Medicare, because I'm 200+ years old. I have Medicare, so it takes forever to get through to them. I can't imagine Medi-Cal as well. And then if you have special needs, that's probably even more challenging. But on positive notes, we do have Ari, who is extremely informative and gave an excellent presentation. I had no clue there was all these different options. So it was very informative for me personally, as well as for me to help my private practice clients.
Yeah,
And
definitely. So definitely, if you encounter anybody that has questions about Medicare, like whether it be that they're going to be new to Medicare, or they already have Medicare and they're having issues, or just have questions about how to move forward for the future, as enrollment windows open, you can certainly refer them to our office, even if we don't know the answer ourselves. Sometimes we don't, that's just a reality. We don't know everything. So, but at least we for sure will be able to point them in the right direction, because I think that's one of the things, Cindy, I think you touched on that, that a lot of times it's frustrating just getting referred to like DPSS, and the person that you talk to may not know what you need, or may be misinformed. And a lot of the times, like I talk to clients and they're like, well, I've been grinding my gears for 3 months and I haven't been able to figure this out. And it's something that sometimes I will be able to address and get them a solution in within, like, 30 minutes. And so yeah, definitely reach out to us. And again, if we don't know, we will for sure be able to point them in the right direction, so that they can get closer to a solution, rather than, just again spinning your wheels and getting nowhere.
Absolutely. Thank you. And I mean, when we have you, I don't know if you know this, Ari. I don't know anything, right now, like you said, everything's so chaotic. But I mean, I have so many clients and friends that share so much concern about, obviously, we're all social workers, or most of us are here. The fact that, with the, current administration and everything going on, are they still able to get telehealth care and mental
Mhm.
health care, on from
Yeah.
Medicare, if everything is going on, and what would that look like? Because obviously, a lot of us, our patients, they're disabled, they're seniors, they don't have
Mhm.
the means to go out to the,
Yeah.
so what does that look like? Do you have any idea, feedback about that right now?
I don't have any updates on that topic. Recently, I don't, off the top of my head, I don't know that there's been any changes. I know that I mean, yes, there's been talk of certainly like slashing those services. I think in terms of like also in the context of like telehealth in general, um because there's these claims of like waste and fraud, and but that's something that in our practice, that's not something that we have. I don't agree with that. That it's wasteful, and that there's like all this is fraud. I mean, certainly there is fraud, but not in the health, in necessarily related to health telehealth services. But I mean, yeah, that is something that policymakers or pundits have like pointed at, as being wasteful. But at this moment, I don't have any particular updates on that topic.
This is Joni. I learned from our former lobbyist that it got approved by legislature until the end of September to do telehealth. So for
Mhm.
those of us who have difficulties in making it into the physical office, and I don't know what's going on, I refer to it as telemental health, which is what I do. I'm not sure how long that's going to go on.
Mhm. Yeah, that's the last thing update that I heard. In regards to, if it's been cut, no, not yet, but we'll see how things are gonna play out. I mean, I don't see, I just don't understand the reasons of why that
Right.
wouldn't be. I mean, I think that it actually helps save money for in many ways, right? So I,
Yeah, I mean, this could be like a whole new group that,
yeah.
but we are getting close to the end. Any other questions, concerns? If not, we're gonna have Joni kind of close this out for us.
Thank you for all the excellent questions. Ari, you're so informative, and Cindy, thank you for fielding the questions and adding so many appropriate ones. Um, I want to thank Ari on behalf of the NASW California Disabilities Council for such an informative webinar and all the different options that are available to us individually as well as our clients, so we could further assist each other and one another of our clients. And I've learned a lot. I did not know all that, and I'm so glad that this service is free for each of us and we can make referrals to you. And I sincerely, and I'm going to speak for all of us, we hope you don't get financial cuts because we all need you. And everybody could reach Ari and the team. And Ari, please tell Ray, thank you so much for her help in arranging this. And you could call him at 800-434-0222, and that we could all work together on this. You're excellent.
Thank you. Yeah, thank you for having our organization.
Thank you so much, Ari. And, thank you for all the interpreters. Of course, Joni, our chair, and Matt for helping us with the tech part of it. Feel free to log off now, and then we'll just have, I think, just me, Joni, Matt, and then Helene, you want the interpreters to log off at 1:30, right?
Yeah, so we're done. This is the
Yeah, we're
end.
done. Thank you
So
so much,
thank
everyone.
you.
All right, have
Bye.
a good rest of the
Thank
day.
you, everybody.
Take care.